Welcome, everyone. My name is Stephanie Wolf, and I am the Membership Relations Coordinator here at Population Connection. I'm so happy we're all here today for a meaningful discussion to mark World Contraception Day. As we all know, when women could choose the number, timing, and spacing of children, they can more easily pursue education and participate in local economies. Now, today, two of our Guatemalan-based global partners are joining us to share more about the reproductive health programs and services they provide. On the call, we have WINGS Medical Director, Dr. Michelle Dubon. Dr. Dubon has been in practice since 2004 and has overseen all technical aspects of clinical services provided by WINGS since 2015. I also want to note that we have the WINGS Program Director on the call, Eric, as Dr. Dubon may get called away during today's event, so we're going to do our best to adapt if that happens. Thank you both for being here. And in addition, we are also hearing from our new partners at WUQu Kawoq, also known as Maya Health Alliance. We'll hear from the co-founder and CEO, Anne Kramer. Anne has been CEO since 2009 and is driven by her passion for building collaborative, culturally, and linguistically appropriate development programs. Now, if you have any questions for our speakers, please drop them in the Q&A box that's found at the bottom of your screen. We'll do our very best to get those answered during the Q&A session, which will be facilitated by our senior analyst, Hannah Evans. For any questions we don't have time to answer, we will provide written answers along with the recording of the presentation slides, and access to the chat box discussion. Now that's it for me. Let's go ahead and jump in. I will send it over to you, Dr. Dubon, or Eric, whoever is presenting. Thanks again.
Thank you very much. It's such an honor to share my passion, because this is a style of life. This is not a job. This is my life, and I'm very honored to share it with you. You can see now a beautiful slide where you can see our truck, where we travel throughout the country providing services. You can see our nurse in white and red. She's a Mayan nurse, so she understands the culture of our people. She provides the services in some places in their own languages. That's a huge plus for us. For instance, yesterday I traveled from my house that is 200 miles from here, 12 hours to come here to provide tubal ligations and vasectomies in that truck. That's our Superman truck that allows us to provide our services. That is an example of a day, a jornada, a service day in a community where the people, the population is receiving information to decide what method they want to accept or receive in that day. So it's a great job that we are performing. You can see our mission is to provide quality services. For us, the word quality education and services is the basis of our work, because we really believe that people deserve the best quality services that we can provide. And our vision is that every Guatemalan can decide their lives. We should give them the opportunity and empower them, women, men, youth people, to decide how many kids, when to have it. And no kids should come to this world because their mother and father didn't know that there are opportunities. Why Guatemala? You know that half of our kids are malnourished under 5 years. That's terrible, because what can you offer to a kid if he or she doesn't have a good nutrition? What's the possibility in their future? So for us, that is a terrible number that we have to work with. 75% of our indigenous population lives in poverty or extreme poverty in some communities. And 1 in 3 indigenous women lives in, they don't have access to reproductive health services. This is even worse in indigenous populations, where there is no accessibility, they don't have any possibility of receiving quality services. Guatemalan women, there's a hand there. Guatemalan women In average, they have 3 kids, but in indigenous populations, there are places where they have 3.7. And we sometimes have women with 18, 15 women today in this jornada, in this tubal ligations activity, we have a women with 11 children. So this is the reality that we are facing in our country. Thank you. And what happened with the education? What we were expecting, that women in every level of education, they have less access, they are worse educated. Kirsten? Thank you. What does the World Health Organization says that we, as every population, should have 23 health workers for every 10,000 people, and Guatemala has 13. So we're a lot under the acceptable number that we should meet. And there's a lot of population that they don't have access to services, to trained services or basic services near their home. Half of the women in our country, they don't have access to any kind of family planning services. So that's a shame, and we have to work on it. What is happening to the hunger map? You can see in Africa and Asia, a lot of countries in red. That means that the countries that haven't met or haven't achieved, the Millennium Development Goal of hungry. And in America, you can see South, Central, and North America, and Guatemala is the only one in red. That it's a big shame. I'm ashamed to accept it, but we have to work, and we really believe that contraceptive is a basic tool to stop hunger and to develop our country. And the same thing happened with chronic malnutrition. What happens if you have 11 kids, if you have 18 kids? You cannot provide them enough food. And what happens if you don't give them food? You will have a malnourished child, and this child will not receive good information, good education, and what will happen with its future, right? The average of sexual sexual intercourse is 18 for girls and 17 for boys. But something very interesting is that the average of first pregnancy is 20. What does this mean? That girls are starting to have sex, but they are not getting protected. They are not having any contraception. So as soon as they get sex, they got pregnant. And we have to work that and stop that, because 20% of our adolescents are pregnant in some moment of their life in our communities, especially in indigenous, very rural communities. The teenage pregnancies are extremely elevated. 60% of our women are using a method. This is much used by non-indigenous women. If you are indigenous, you are more or less likely to receive a modern form of contraception. So what do? We really believe that reproductive health is the first step in the fight against poverty, malnutrition, infant death, gender inequality. We really believe that we are giving them a tool to improve their lives. We can improve their lives by contraceptive methods and educational. The next one, please. The next. So we only have like 3 minutes. I love this picture. You can see one of our nurses providing education about contraceptives, and a lot of patients receiving, or future patients receiving the information in a house. They are in a community, in the house of a promoter, receiving the information, and some of them are going to receive an IUD, some of them an hormonal implant, some of them are going to receive an BIA as cervical cancer screening. So we are improving the lives of our population one by one, a patient at a time. So you can see how we can give services practically in any place. Here's the map of Guatemala. Where are we right now? Our main office is in Antigua, Guatemala, but we're practically at a national level. Our plan is to be at a national level in 2025. We have a volunteer promoter network that are 27 volunteer promoters that offer education, counseling, and short-acting contraceptives in their communities in a very intimate system. We have stationary clinics. Some of them are ours, and some of them, like where I am today, are from the Ministry of Health. I want to show you a little bit, because when we started doing the surgeries, we were in 3 hospitals, and now we're almost in 60. It would be impossible for us to have 60 spaces to provide surgeries. So today, I'm in the Ministry of Health doing 2 ligations, a vasectomy day. So we travel with our truck with everything that you're gonna see. This is where we do the disinfection of all the equipment. This is our camilla, where we do the surgeries. So this is a Ministry of Health facility, and they allow us to bring all our stuff, and we do everything here. Then we finish, wrap everything up, and go to the next town. So tomorrow we're going to be 100 kilometers from here. Our mobile units are these beautiful trucks that you see, where we can put everything in and provide LARCs, cervical cancer screening, and surgical contraceptives throughout the country. This allows us to be mobile. And why cervical cancer screening? Because cervical cancer is the main cause of death in Guatemala. It's terrible, the situation, and there's no public place to receive treatment. So what we try is to offer a cervical cancer screen to every patient that we can. If we give them education or give them a service, we offer always cervical cancer screening and treatment with thermocoagulation. We also have our peer educational program, the youth peer educational program, that is, we want them to reach young people in their communities with educational and referrals. At the end, preventing teenagers' pregnancies. So what is our impact? We have, there's a lot of numbers that we can see. I don't know if you're, you know, the Mary Stopes International Impact Tool is the way that we estimate our impact. So since 2001, we have reached more than 350,000 men and women with sexual and educational information and services, 350,000 unintended pregnancies prevented, almost 2,000 infant deaths prevented, and 120 maternal deaths prevented. And how have we done it? Throughout our education and services. We truly believe that we are saving lives, and not only saving lives, but improving their lives. So please get involved. You are all welcome to know more about us. You can see our page, our web page here. Please follow us, our media, and we are always open to receive questions, to receive visits, to talk. If you want to hear more about us, here we are. Yeah, that's our website.
Thank you, Dr. Devon. I appreciate you hopping in between. I know you have a busy day. And up next, we'll be hearing from Ann Kramer from Maya Health Alliance.
Thank you so much, Michelle. Thank you so much for your presentation. It's wonderful to hear from you. I'm Ann Kramer from Maya Health Alliance WINGS and Wuqu Kawoq, and it's a pleasure to be here with all of you today, celebrating World Contraception Day. And I just want to say we're great partners also with WINGS, and so it's wonderful to be sharing the platform with them today. I look forward to sharing more about who we are and the work that we do in transforming health in rural communities in Guatemala. In WINGS and Wuqu Kawoq, we really focus on healthcare, specifically around chronic disease and things that are really spanning the lifespan for women and children in Guatemala. Similar to WINGS, we focus on high quality healthcare and really reaching people in their communities. No matter what their language is, no matter where they're born, it's really important that we can provide high quality services for all people in Guatemala. We serve about 10,000 patients a year, and because we do long-term chronic disease focused around contraception, looking at women during the health span, during pregnancy, looking at chronic disease such as hypertension and diabetes, we often are visiting the same patients over and over again. So we usually do over 35,000 patient visits every year. Similar to WINGS, we work across the Central Highlands of Guatemala, but we don't have quite the expansion that WINGS does in where we work. We are founded in 2007, and since then, we've grown over the years. We currently have 88 team members, and we're really proud that over 90% of our team is indigenous Maya, and 80% of our team are women. I'm one of the few members of the team that are from the United States. I live here full-time in Guatemala. When we formed WINGS and Wuqu Kawoq almost 17 years ago, we did that at the request of the community, who came to us and said, you know what, we really want to work with you to provide high quality healthcare in the language of our people. And in doing that, we decided to have our organization be born on the day WINGS and Wuqu Kawoq, which in Kaqchikel Maya is the day for healers and midwives. And in doing the work, we really wanted to reflect the organization to be focused on the values and the vision of the communities where we're serving. So that is what our name means, and our glyph or our logo is the term Kawoq, or the day on the Mayan calendar, WINGS and Wuqu Kawoq. So as Michelle touched on, Guatemala has many challenges for women and children. It's one of the most unequal nations in the world, and especially for women and children, they're shouldering the brunt of that inequality. And we have a lot of barriers to overcome, such as distance and cost and language. But specifically due to a 36-year civil war here in Guatemala, there's a lot of things that are really hard to overcome by just providing, transportation or by just providing money. There's a lot of hurt, there's a lot of fear that are just deep within the communities, that even going to some of the central health posts in Guatemala is difficult for people because they don't speak their language, or the doctors are from Guatemala City, or they just can't connect, or they have fear of the government. So we're trying to overcome those barriers by providing healthcare in the language of the people, providing healthcare by nurses who are from the communities that we're serving. Some of the health gaps that Michelle touched on, I'll just jump through quickly. But, Mayan women are twice as likely as non-Indigenous women in Guatemala to die as a result of preventable pregnancy-related deaths. And that's 16 times more than is occurring in the United States. Guatemala suffers from one of the highest birth rates and highest rates of teen pregnancy in Latin America. And as Michelle touched on, unfortunately, we have some of the highest cases of malnutrition in all of Latin America. So there's a lot to overcome, and we can't do this without working together and without support of everyone like you joining our call today. So what is our solution for Maya Health Alliance? We really want to focus on forming a team of people who can serve their communities, who are extremely well trained. They understand the barriers that our patients face, and they know how to treat them. They know where to meet people, and they know how to treat them with care and with dignity. All of the communities where we work have invited our partnership. We work with them at all steps of the way, whether we're doing family planning, whether we're working in diabetes, hypertension, cervical cancer, we're working with the community at every single step. And we're always trying to identify where women can be leaders and using their access within the communities to step up and present themselves as new leaders within their communities. So the work that we do in Maya Health Alliance, specifically around family planning and contraception, we focus on providing access, support, and education. We have a team of over 30 nurses that are providing community-based family planning services in 6 languages. What this looks like on a daily basis are backpack nurses, nurses who go out with a backpack, take public transportation into communities, and whether they've already done a class within a community, so they're coming to provide family planning services and cervical cancer services, or they're just going into community to start to getting to know a community, they are an ambassador around the work that we do, around women's rights, around health equity, and the fact of them being from their community, or it's a community that is near where they are from, they speak the language, they can enter in, they understand who the leaders are within the community. Specifically within family planning and contraception, we do classes. These classes specifically look like this, where we're working with women in their homes, very similar to WINGS, where when you're providing classes within people's homes, working with women where they feel safe, away maybe from the gaze of husbands or partners, where they can share with women that they trust, we learn about the entire lifespan, not just sexual reproductive care at specific ages, but overall how humans, men and women, develop over a lifespan. This is something really important because we see that mothers are going to be able to teach their children, sons and their daughters, about what is it going to be during these different life changes. We also, after every education class, we provide all different types of contraceptive methods. So we provide long acting, such as Jadel, we provide copper IUDs, as well as hormonal IUDs. We also provide short acting methods of pills, Depo-Provera shots, and condoms to all of our patients, anyone who would like to participate. You can see that oftentimes on the left side picture, our community nurses go in and they sit and they talk and they share education and they meet people where they are. They gain trust and confidence, sharing about what the methods are, talking about, women's rights, equity, health, and inclusion, in order to then provide the services that they can within their house or within their community or within a school. What we try to do is go to the communities and be present where they are. This really cuts down on the barriers of transportation, of cost, the failure of trust within the system. We provide education. And something that is really hardwired into the work that we do is community collaboration. We work with the municipalities and the municipal governments, such as on the left-hand side, you'll see a picture out of Facebook where the municipality is promoting the clinics or the jornadas that we will be doing within their community, everything that is provided free. In the center is a community workshop that we're working, providing information and education about family planning methods. And on the right-hand picture is one of our nurses posting signs about the services that we provide for free for family planning, contraception, anything that a patient might want to ask within the public health center. And as you'll see, it's right below the WINGS sign. Why? Because we work really closely with WINGS. We actually work together with WINGS, not to duplicate services within communities. And we refer all of our patients that would like tubal ligations or vasectomies to WINGS. So when we're talking in a community, we will say, are you interested in a permanent method? And if they are, we provide all of the steps and then we refer our patient and hold their hand till we pass them off to WINGS. We find this as a really important step in doing care here in Guatemala, is that we can work together. We should not be duplicating services where we can be working together. So we have to make sure that we're hitting all of the communities where they need to be. Another key piece of the work that we do is gender equity and inclusion. In Guatemala, machismo, or the belief that men are better than women, is a real real cultural barrier. It's something that a lot of women are struggling to overcome. In general, that communities are struggling to overcome. Oftentimes, we'll talk to a woman and say, "Are you interested in a method?" And they will say, "Yes, I am." So how can we overcome that? We're working hard to include male partners and male community members in every step of this educational process. Men too should be learning about all of the different methods that are available, learning about what their role is in preventing pregnancies, learning about what their role is in the family, and how to help the entire family shape their future. It's something that is difficult. It takes many steps. It takes a lot of trust and confidence in working with the community development groups, one-on-one, working with the municipalities. But by hiring males, by having empowered men who can talk about methods easily, who can go to a soccer team and share, all of the goods and bads and understandings about contraception, methods, sexual reproductive health is really important, because sometimes men don't want to hear it from another woman. And so hearing it maybe from another male will open up those doors. And what we're offering and hoping to do is that partners, male and women partners, can come together to talk about what methods would work best for them. We have a long way to go, but these are steps that we're taking, and we're seeing slow improvements within the communities. Something else that we work specifically in is in maternal health, and we work very closely with midwives in order to detect high-risk pregnancies. And something that we do once a mother has her baby and things are good after delivering her baby, we do provide methods to her and talk to her about, is she ready for having another baby? What does her future look like? So what we're trying to do is really capture women and men at different periods in life so they can have all of the options available to them about planning for their future. What we have been working on in the past couple of years is really reaching Indigenous youth, especially in rural communities. In urban centers in Guatemala, sometimes they have more access to information and different contraceptive methods, but in rural communities, it can be extremely difficult for them to access, especially education and especially services. So we're working really hard to reach Indigenous youth in these communities, and there are many barriers, and we are slowly overcoming them. On the left, you can see some of our one of our male nurses doing a class in a public health fair. So it became a way for young men and young women to come up and learn about our services, to learn about different education classes that we're providing. We're going to soccer teams, we're going to different youth activities, but that is a barrier, and that's something that we're really working hard on, how to reach Indigenous youth in rural communities. And one of the ways that we do this is really by doing research. We focus heavily on understanding the communities and the work that we're doing deeply. We specifically focus on doing deep-seated research within the communities to help us understand the work that we're doing. So in the reproductive healthcare sector that we're working on within Guatemala, we've really tried to understand what are barriers to care, specifically identifying that we ourselves as healthcare providers have barriers around the contraceptive methods that we're offering. And so when we were doing this research, we understood that our nurses may accidentally be providing, or pushing a patient towards one type of contraceptive method. And so that's something that we've really been working on, is how can we do shared decision-making, for our patient, and that our nurse is not pressuring them to get one type of service because she, as the nurse, identifies this might be a better option for that patient. So that's something that we've really been working on, is understanding, who are we working with? What is the impact of our team members? And we've seen better to do shared decision-making. We have better results and better outcomes, having happier patients choose methods that they actually stick with for a longer time period. We serve about 2,000 patients a year with family planning methods, and we're slowly increasing that. So thank you so much. It's a pleasure to share with you today, and I look forward to talking with you more.
All right, thank you so much. That was a really great presentation by everyone, and it's so great to hear more about the important work being done in Guatemala. It's really fascinating. As usual, if anybody has any questions that they'd like answered during this discussion, please feel free to voice them in the chat. We've got about 30 minutes to talk through any questions or insights. So please feel free to do that. I've got a whole list of questions that I can ask. So the first thing that I wanted to cover was the fact that Guatemala has the worst gender equity gap in the Americas. And I think you mentioned that in your presentation. And I just wanted to start off the discussion by asking why that is. How does Guatemala differ than the rest of Central America or even South America? All of these countries, you know, have a pretty pervasive machismo influence. So what makes Guatemala different, and why is gender equity here so much more pervasive?
Thank you, Hannah. It's a really good question, and I think it's somewhat difficult to really understand why is it so deep-seated. But I think in general, Guatemala is a very traditional and conservative country from where it comes from, looking at contraceptive rights, looking at access to healthcare, access to education. And I think with that comes machismo. Package of what is Guatemala tends to be very conservative. And so women, unfortunately, fall under that as well, as being, in general, less able to access almost everything. And when you're looking at rural indigenous communities, the machismo culture is extremely high, to the fact where women oftentimes have to ask permission to leave their household, permission to give specific medicines to their children. So contraceptive use can be even more difficult for women to access. And so sometimes they are doing it secretly without their partners knowing.
Thank you. Eric, do you have anything to add to that?
I pretty agree with him.
Okay, thank you. Yeah, Guatemala is an interesting place because it does have such a strong influence from indigenous cultures. There are over like 25 languages spoken in Guatemala, right? So there's a wide variety of cultures and backgrounds and just languages. So I imagine whenever you're doing community outreach and going into rural places, it's really important that you can speak the local language in order to really help build trust and transform. So it's great that both organizations do that. There's a lot of questions kind of asking just more broadly about some of the cultural factors that influence the delivery of reproductive health education and services throughout the region. And you guys talked a little bit about how to navigate this, but I'm wondering if you could expand a little bit more, specifically looking at like how, you know, which demographics of people you focus on, if you're looking at more adults or youth, and how that differs in terms of uptake or acceptance or whatnot. Eric, we can start with you if you'd like, or Michelle. I don't know if you're still on the call, but.
Thank you. Yeah, I think for us, WINGS is very important. Our human rights based question, and I think on the legal base in Guatemala, since you are 14 years old, you can get access to contraception. And I think that's also a barrier because in public services, there's a lot of requirements like that are not specifically on the legal basis. For example, if you are 16 years old, sometimes they ask you to live with your father or with your mom, and that's not legal in a way. Or in some communities, they're also seeking for the permission of the husband. And that's also not in a human right-based posture. So for us, it's kind of educate also the people and the public services that we are just doing everything in the frame of what it's legal, what is a right for the people to get services towards their care and their health. So little by little, we are just trying to make more services that are specialized in these different populations, so we can kind of explain but make sure that they have the access they need towards their sexuality. So we are pushing on that, working with youth. We are pushing on that, the free decision making of women. We are also pushing the involvement of men in this decision making, but also making questions of how to be more accurate in the deliver strategy for example, the sexual diversity community or the community with disabilities, for example. So we are trying to be more wise in how we deliver our service that way.
I see. Makes sense. Thank you. And do you have anything to add to that?
Yeah, I agree with Eric. I think the legal situation in Guatemala is difficult, especially for reaching youth. Anyone under 18 does have to have a parent's permission. And when you're working in conservative, more closed communities with indigenous communities, I think it's really key that you don't break that trust. And so that's what we're working on constantly, is working with the community development groups, working with the communities, knowing our nurses, knowing who we are, because we don't want to break trust. Our goal is to be able to overcome these barriers together and work towards the future. And in looking at one of the questions in the chat about getting pushback from men and husbands who want more kids than a wife does, yes, that does occur. Sometimes there is a idea that men or that, I want so many children because that means I'm, rich in who I am, or that they will help me when I'm old. There is that belief. However, I think there are some changes occurring as malnutrition becomes a more public topic and becomes something that's described throughout the country as a real difficult situation. And at the same time, as we see migration happening out of Guatemala towards the United States because of the pressure from climate change that's happening with these communities, that's affecting, their livelihood and agriculture, I think more and more people are saying, you know what, this is hard. Life is hard. We don't have enough food to give our children. So it's changing, but very slowly. And I think reaching women, youth, and rural communities are probably, the biggest barrier that we're overcoming. And if we're looking at gender or gender different identity or trans communities here in Guatemala, that's even more difficult. And that's something that we have not ventured heavily into as much as WINGS has.
Thank you. And there's a couple of questions just asking more broadly about kind of the cultural influences within Guatemala that might prevent people from utilizing family planning, like, for example, the Catholic Church. And I know many of your initiatives focus on indigenous groups and populations, but it's still, I imagine that the influence of Catholicism is relevant to discuss whenever we're looking at the uptake of family planning. So what do you have to say about that, if anything? Is that still a barrier, or is it more about access, or is it both? And we can start with you if you'd like.
Yes, I think the Catholic Church over time has been a barrier. But what's interesting is there's a major religious shift happening within Guatemala that's happening across Latin America, where you're looking at evangelical Christian religion taking over really the role of Catholic Church. So I think that's created a little bit more maybe open acceptance in some religions in the Christian identity for contraceptive methods, but not 100%. So I think the Catholic Church is waning a little bit their impact just because of what's happening with the culture right now.
Right, but the evangelical Christians ostensibly have a similar philosophy behind contraception, right?
Yes, some of the sects, there's many different groups, and some of the sects do and some of them don't. Some of them are a little bit more open to being family-based and saying, we want to be able to take care of our family. So some of them are more understanding of family planning, maybe not 100% against them. I would say maybe welcoming is not fully there yet. No.
Thank you. And Eric, is there anything you'd like to add to that before we move on?
I would say that it's interesting that in a political frame in Guatemala, it is the Christian Evangelical Church the one that's leading most of these law initiatives that are trying to kind of shut down the sex education or the work we do, which these law initiatives hasn't passed, but what I'm trying to say is that the evangelical church is the one that is more strong in this posture. I think the Catholic Church is playing kind of like we don't condemn, but we don't want to prove at the same time. It's like they're kind of pretty neutral. We have had really good experience working with the Episcopal Church, if that's a great way to say it. And we have worked with them in Guatemala in different parts of the country. They have even allowed us to do the clinic days in their churches and speaking with the leaders as well to make more education for their groups. So it's good that even if it's still a difficult challenge, we can also see like a little bit of a way that is open up to work together.
Great, thank you. And what about the governments? Are your two organizations working in coherence with the government? Do you receive support from the government? Is the government in support of what you're doing, or is it more of a barrier? And beyond that, are there any policies that you, as an organization, are working to uphold or expand or eliminate that might influence the way that reproductive health is received throughout the region? And we can start with you. Eric, you've got a little like an echo on your microphone. I don't know if it's your little earplugs or what, but just FYI, I don't know if there's anything that can be done. We'll start with you, Anne.
Thank you. Yes, the government, I would say local governments working with the municipalities has been very strong and very good at promoting our services, at being able to collaborate with the the Women's Office through municipal office. I would say in general, the federal government is more difficult. Collaborating with them, we discuss with the Ministry of Health the work that we're doing. They're very aware of our work, and that is great. I would say the difficulty that we have had is in advocacy. There is a law here that was put into action about 10 years ago that's now really being, I would say, used within Guatemala, which is the NGO law. And if we as an organization do advocacy, we could be shut down quite quickly. And so we're very careful about what we do as an organization around advocacy, because we don't want to shut down our service side work. So there are other organizations that we talk to and collaborate with who are doing more of the advocacy side. And so that is difficult within the political climate here in Guatemala.
I see. Thank you. Eric?
Yeah, I think the government is supporting the work. I don't think they have the full capacity to deliver what the population needs. But we have an agreement with the Ministry of Health, and that's the piece that has opened up a lot of those models. So we have their support, but still there is a lag the government can do to improve themselves, the accessibility for these services.
Thank you. And I imagine too, just given the very long and tumultuous history in Guatemala, and you spoke about the Civil War and the kind of constant battle that's going on to try to just uphold and establish indigenous rights, also acts as a barrier to broader medical outreach, to trust amongst communities for modern medicine and contraceptives especially. So it really speaks to the importance of the work being done by both organizations. Let's see here. So in terms of like what your organization has really established and done very well, there's a question here asking about what types of best practices, maybe what have you learned as an organization that you can recognize as being very functional and something that you might be able to apply or scale within Guatemala or even the broader Central or South American region? Anne?
Yeah, thank you. I think best practices that we've really focused on is providing quality of care. So what that means is you really need to speak someone's language. You really need to be able to go and meet them where they're at. And I think when you look at scale, it is a difficult thing to do, but when you really can utilize the language and the cultural understanding, you can do it much better. And that's been something that we've been able to do, at least across Guatemala. I think in doing contraceptive work, being able to work with men is something that we're really exploring, especially to be able to scale across Guatemala by reaching those hard to reach rural communities. I think those are really some of the best practices that we've been able to do. And also I think a key piece is really training and empowering your team, letting your team being able to make decisions, really understand the vision and the mission of the institution has really been key.
Thank you. And just piggybacking off of what you said, I'm wondering if you could expand a little bit more on what you, on behalf of your organization and just in your experience working with this organization, what you think the role of men and boys is within the broader context of family planning and really establishing better reproductive health care. Obviously, you've spoken about how patriarchal influence can kind of act as a barrier to broader uptake, but you're working very closely with men and boys and communities, and I'm wondering if you see that men are very integral to the success of family planning, and in what ways?
Yes, they are. They're key to the success, because when you can have a male in the family or a male partner say, yes, let's do this together, you have much higher uptake, and you keep that uptake ongoing for a much longer period of time. And I think key to changing machismo, and I think Eric can speak to new masculinities much better than I can. I think it's really key that if we're going to change the future of Guatemala, we have to start with men and with boys too, and with boys and children, and about what they believe about women, about gender inequality. And contraceptive methods are absolutely essential to providing choice for everyone. And having boys start at an early age learning about that is really key.
Great, thank you. Michelle?
Yeah, I would like to add that we have experienced with vasectomies a really change of the activity, because when we started 8 years ago, everybody told us we were crazy. No man will accept a vasectomy, and that hasn't been our experience. Every time we go to an activity, a vasectomy clinic, we experience that there's a lot of men, especially young men with no kids, want a vasectomy, and they don't have access to it. They don't have anywhere to get it. So they're very happy when we get an offer. And with the last question, I would like to add something, that the Ministry of Health for us has been a very strategic ally, because most of our activities are done on their facilities, and we have an agreement, a 5-year agreement that we're renewing now. That has been the key of success for us, and the doors for us.
Thank you. You cut out a little bit there, but I thank you for that. And Eric, I was going to just ask if you had anything to add, especially about the role of men. I imagine that you are a really important influence in communities. And I'm wondering, whenever you go in and talk to community members, what type of conversations are had, and if men are surprised to see you in this role promoting family planning, or do you receive any pushback if you, in contrast, get a lot of support, or what that dynamic is in communities?
I think in the beginning, we start including men in the conversation, trying to make them visualize the benefits that they can have from supporting their wives and their families to involve in family planning. And after that, after they can see their personal benefit, we can start having more in-depth conversations on how can they really be allies of their families, and not only in the family planning, but all the healthy relationships that they need to start managing and developing within their families. And I think the conversations, the more like interesting conversations I have had with men and also with youth, with male youth, is that in this Marxism structure, where you need to be successful, rich, have a good job, car, houses, and everything like that. When you live or you grow up in a community where you don't have access to education, and then you will get a job, and then you will get money, you will get houses. The first thing or the only thing that's left for you is to become a father. And so also like really working the new masculinities or tear down the machismo structures, even if you don't speak directly to family planning, it gets there eventually, because that's one of the things that I have been, especially in youth. I just feel like motherhood is the easiest thing that I can get in this system that doesn't allow me to develop all the other parts of myself in that way. So I think that that's really interesting on my journey talking with men around that.
Yeah, thank you. That's a wonderful answer. I appreciate your take on that. I'm wondering if Anne, you could start, and then Eric and Michelle, if you'd like to follow up on just some of the major changes that you've seen within communities since you've started working within your respective organizations. Obviously, the work that you're doing is very important, and you're providing direct services that have direct and immediate kind of results and benefits. But in terms of the long-term like shifting of community structures and patriarchal norms, how have you seen things differ? Are more women, because they get access to contraceptives, now attending school? Are they, in what ways are they becoming empowered? And how are communities shifting in your perspective and through what you've seen in your work?
Thank you, Hannah. It's a great question. I think over the 17 years I've been doing this, I think the greatest change I've seen, honestly, is in two key pieces. One is with our team, seeing our staff grow, especially nurses who came in maybe, quiet and meek, sort of as is done here in Guatemala culturally. And over time, see that in our organization, they have a voice and they can use it and they can give us feedback and they can grow within the institution. And then over time, they become a nurse manager, and now they're managing an entire program, running nurses across an entire section, and see the confidence that they have and the expertise that they have, and that they become trainers, and that they're training nurses on how to do contraceptive methods, and that they're, analyzing and can be, experts in this area, and what power they hold within themselves, within their family, to make decisions. The fact that they're able to bring home paychecks to their families, and they're able to help make decisions for their own children. And seeing that transformation over the last 17 years has been really incredible, not only within our institution, but also within WINGS and other nonprofits, what that does for women, their communities, and their home when women are able to be empowered. And because of that, as they are women going out to the communities and serving our patients, it's really phenomenal to see them say, I understand where you are. I've been there too. I'm here to help you. Like them being able to really speak from that in their Mayan language in a way that I never could is absolutely extremely powerful. And over time, we're now seeing men show up in our clinics or, to a visit to say, we together want to get family planning. We want to make a decision for the future. That's not happening all the time. We have a long way to go, but that did never happen 17 years ago. So the changes are happening. It does take a long time.
Thank you so much. Wonderful answer. Michelle, do you have anything to add?
I will say that as an institution, we have grown with staff members. We started like with 20 staff members, and now we're more than 100, I think. And people are starting to recognize us. So they said, my sister had a surgery with you. Now I want to be with you, receive a surgery with you, because you give such a good treatment and such a good way to provide the service. So as an institution, we have grown, and we have seen a difference in the communities where women are more open to receive services without the permission of their partners, of their male partners. So I think it's something very slow, but we can see a difference.
Yeah, that's amazing. It's really great to hear just about the real transformations that you're seeing play out at the community level. Things are shifting, and it's wonderful to see the impacts of empowerment and people being given a voice. It speaks again to just the importance of the work being done. Eric, I'm wondering if you could touch a little bit on some of the future goals for WINGS in terms of what you're doing, if you want to expand, what you're focusing on now and into the future, maybe any challenges that you see or things you're looking forward to.
Yes, thank you. We have our strategic planning for 2025, which is reached national level. So according to that, we are opening new regions this year in the west of the country. So we are going to with a really interesting challenge because there's one of the regions of the country with higher machismo and also teen pregnancy. But we also feel ready to go there because we are developing our strategy for youth. It's called the appreciation care for youth, or specialized care for youth, which is a strategy to deliver more services, especially for youth. And another thing, we are implementing our strategy or diversity, equity, and inclusion, which is inside our house, like in our culture as an organization, and how do we treat each other, and how do we ensure that we are we have equity, we have inclusion, we have respect for diversity, but also in our services. How do we reach more in-need populations of youth, of people? So we are open to these new paths, and we know we have a lot of challenges coming up, but we are also getting prepared and ready to just overcome those challenges.
Amazing. Thank you. A lot to look forward to. And we have one more minute left, and I wanted to make sure we get to as many questions as possible. And there's one that I think is very relevant for all of us, especially those of us tuning in today on the call, which is, what are the priorities for action that those of us who are listening and who are residing in the United States, what can we do to help? What's most poignant and relevant for us to be doing, and what ways can we affect change most readily?
Definitely. Thank you. Well, I think one of the greatest things you can do is share this information. I think so many people don't understand what's happening in Guatemala. Why are people crossing the border? I think it's really misunderstood. So if you can understand that people here want to live in their communities, they want to have healthy, happy communities, but they need access to healthcare, they need access to contraceptive methods, they need those access so they can make decisions for their own bodies. And so sharing this story, sharing this information about the work that WINGS and that My Health Alliance is doing is absolutely fundamental. You can always donate, and you can always push towards having others have better access, whether worldwide. People need to have better access to contraceptive methods.
Absolutely. Well, we are right at time. So thank you all so much. It was so wonderful to have you all on the call. We had a great discussion, and it was really special to get to learn about both of our partner organizations. We're so proud to partner with both of you, and look forward to continuing to work together in the future. I don't know, Steph, if you have.
Yeah, I just want to reiterate your thanks. Thank you to all the speakers. WINGS, I know you had a lot going on today, so thank you for showing up and for elaborating on all the amazing work you're doing with so many different audiences. It was amazing to learn more about all the work you're doing in Guatemala. Before we head off, I do want to make note, Population Connection is a membership-based organization. This event and all of our programs, including our global partners programs, where we're able to support such amazing organizations like My Health Alliance and WINGS, is made possible by the support of generous members. So if you haven't joined already, I hope you will consider joining today. And I'll be in touch soon with an email of the recording of today's event, along with presentation slides and access to the chat box discussion. So thank you again to everyone and our speakers for tuning in today. I hope you all have a wonderful rest of your day.
Thank you.
Thank
Bye.
you. Bye, everyone.